Tulane's collaborative AI design sprint, exploring the future of health equity in the age of AI, was hosted by the Tulane Center in Excellence in Maternal and Child Health, Tulane Center for Community Engaged Artificial Intelligence, and Nieux Edge. The day began with grounding in the purpose, understanding that systemic barriers demand new approaches. Technology needs to be grounded in human connection and equity. The volume of work continues uninterrupted, while simultaneously there is a need to explore what partners could do together, how they could co-create solutions, and commit to working together. Participants reflected on why the work mattered to them, both critical thinking and understanding intellectual power as a future skill, challenges and fears around AI and the skipping of foundational analytical skill development, bias in creation with AI, for example, understanding Black birthing experiences were presented as more extreme during outputs with artificial intelligence, and individuals also reflecting on being proud of their own brains, their ability to interpret things, their intellectual property, and understanding where there was future-facing ability for AI to become one's assistant, to automate non-critical tools so humans could focus on thinking. Risks were raised by the group, both those of losing individuality through the flattening of culture with artificial intelligence, and the fears that populations would become monolithic. Challenges and risks were also raised around power, the environmental impacts, and access to electricity. Overall, when the power is down, there still needs to be paper and people as a contingency plan, and the erasure of lived experience arising. Participants joined small group chat rooms where they discussed critical and emerging issues at the intersection of AI, from maternal and child health to public engagement and community translation, AI use in government, and then AI capabilities and drawbacks, both the possibilities and challenges around bias in the future. Dynamic conversations were had around the roles of telemedicine and predictive analytics, the way in which AI can support rural health access, as well as the ability to learn, apply, and remember who benefits, who designs, the bottom line, and the risks that come about through AI. Findings from key informant interviews, as well as information gleaned from the group, showed that lessons from the past included distrust of systems, reliance on external funding, and academic disconnects from maternal and child health, while opportunities around AI remain in the role of admin task reduction, research, and data translation. Participants continued to raise challenges around bias, security and surveillance, and the equity issues that continued to arise, making them feel as though the ability to address equity was a closing window. Participants then engaged in a design sprint, coming together to design applied AI projects throughout that afternoon, thinking about ways that they could solve problems and develop examples. Groups focused on creating joint prompts, addressing bias and stigma in language, thinking through social media campaign designs, and overall engaging in conversations around quality improvement regarding bias, diverse inputs, and subsequent diverse outputs. Further findings around insights, partnerships, and needs, and each team's role were highlighted, closing out the day with the reminder that each and every individual, group, and organization in the room has the expertise to define the future, the data, the infrastructure, the experience, the trust, the equity lens, the conviction, interests, and position to lead this work and the conversations around AI and maternal and child health into the future.